Now, these viruses have been known to be infectious to man for a very long period of time, but they usually produce mild respiratory illness, with the exception of two previous viruses, SARS-CoV and MERS, which is Middle Eastern Respiratory Syndrome. The thing about viruses is that viruses are very fragile organisms, and they need a host cell to actually survive and to multiply. Now, all of you have seen pictures of the coronavirus. The virus has spikes on the surface, and that's why it has the name corona, which means crown. So these spikes are actually protein, and they're called spike proteins, and they are able to attach to certain receptors on human cells. The receptor which binds to SARS-CoV-2 is called the ACE2 receptor. And the presence of that receptor, together with a protein called TMP-SSR2, both these are essential for the virus to get into the host cell. And once the virus enters the host cell, it begins to multiply, it damages the cells, it damages adjacent cells and produces infection. Now, there are certain organs in the body which have an abundant number of these receptors. One, the lungs. So it is predominantly a respiratory or a lung infection. The gastrointestinal tract, as well as the kidneys. So these are the organs which are mainly affected. Now, I'm sure all of you know the symptoms of COVID-19. It usually produces dry cough, extreme tiredness, and fever. And the other symptoms are nasal congestion, sneezing, body ache, loss of smell and loss of taste. And in severe cases, people can have difficulty breathing. Now, the important thing to understand is that 80% of people who actually have the virus are asymptomatic or have minimal symptoms. So sometimes they don't even know they are infected. About 15 in 100 will have symptoms severe enough to require oxygen. So they will need hospitalization, and 5 out of 100 will become critically ill and may need ventilation as well. And the people who are more likely to be critically ill are people who are older, greater than, say, 60 years, and people with underlying disease like hypertension, diabetes, cancer survivors, overweight, obese individuals. These are the people who are more likely to be critically ill. Okay. Now, we've had so many viral infections in the past. Why are we so concerned about SARS-CoV-2? Why are we talking about COVID-19? In what way is this virus different from other viruses? The first thing is, this virus is very infectious. It is very contagious, and it can easily spread. One infected individual can actually infect 4 more individuals. And those 4 individuals will infect 4 people each. So it tends to spread very quickly and exponentially. And that's why it's become a pandemic. And all the way from China, the whole world has been affected with this infection. The second thing is, the virus is relatively robust. So it's quite a strong and sturdy virus. And it survives in the air, it can survive in the air for up to 3 hours. On surfaces like plastic and stainless steel, it can survive for up to 72 hours, that's 3 days, and on cardboard for up to 24 hours. So if somebody touches an infected surface unknowingly and then transfers that virus to the mouth, eyes, or nose, they tend to get infected. So these are the 2 features about the virus which are very different from other viruses. But yet, there is some good news. The good news is that SARS-CoV, that is the first coronavirus, or the lethal coronavirus, killed 15 out of 100 infected people. MERS actually killed about 34 out of 100 infected people. And Ebola virus is very deadly. 50% of infected individuals can die. But with SARS-CoV-2, the death rate is actually not higher than 3.4%. And it, in fact, may be much, much lower, because there are lots of people who do not have symptoms and who still carry the virus and may not have been detected or diagnosed. So in a nutshell, this is what I think is important for all of us to know about COVID-19. So that's my answer, Vasudha.
Thank you very much, Dr. Vani. It's such an explanatory answer in itself. And I would like to ask why people are advised to be quarantined for about 14 days specifically.
Yes, 14. 14 is the kind of golden number these days. Why 14 days? Because when a virus infects a human, it takes some time for the virus to multiply. And it takes about 5 or 6 days for symptoms to show up. But sometimes the symptoms can be delayed up to 14 days. So that's the reason why we ask people to quarantine for 14 days. Now, quarantine means somebody who's exposed to the virus. Say they've been in contact with somebody who's had the viral infection, but they don't have the virus. They're asked to be separate or quarantined for 14 days to see if they develop the infection. This is different from self-isolation. Self-isolation means if somebody actually has the infection, and because you don't want them to spread it to anybody else, they're asked to self-isolate because their symptoms may not need hospitalization. And of course, another term which is commonly used these days is social distancing. So social distancing is actually maintaining at least a 1 meter distance between two individuals so as to prevent spread of infection through droplets, through sneezing or coughing. So that's the answer to quarantine for 14 days.
Okay, thank you, Dr. Vani. And Dr. Mangalam, I have a question for you. So what measures can be taken to boost my immunity and to prevent COVID, me getting affected by COVID?
Yes, before I start with, I wish you all a very good evening. The question here is ways to boost one's immunity. So if you think a particular food or supplement is going to boost your immunity, then I'm sorry to say that you're wrong. There is no single proven food or supplement that can boost a person's immunity. Certain nutrient deficiencies can impair our immune system. So we can take those as supplements so that our immune system can function normally. Supplements like vitamin C, vitamin D, zinc, they may help. And we can also include turmeric and ginger in our daily routine. We should adopt a healthy lifestyle and we should eat a balanced diet and we should be mindful of our weight too. Exercising is very important. We should have a routine actually. For those who have not been exercising earlier, I'd like to tell you all, please don't start with high intensity workout just because everybody says exercising is important. Start with something lower which will suit your body and then gradually you can move on to higher ones. So in what way exercise helps us? Exercising causes release of a hormone called endorphin. Endorphin can be called a happy hormone or a pleasure hormone. So it is positively related to one's mental well-being, I would say. So it is important that we should definitely spare some time of our day at least for exercise. Yoga and meditation, of course, helps. Obviously, we should have a sound sleep and we should remain well hydrated. And smoking needs to be quit completely. And please limit your alcohol intake. And during this time, it's not uncommon for someone to be in a state of, say, indecisiveness or anxiety or in depression. Please reach out to us for assistance in case if you find difficulty in coping with yourself. Stress by itself can lower a person's immunity. So please try not to be stressed. I know it's easier telling, but then it is we who should take measures to keep our spirits up and no other person can do that for us beyond an extent. So these measures may, I emphasize, these measures may improve a person's immunity, but it really does not guarantee protection against contracting COVID. Social distancing is the only way out. So just because you are following all these, please don't skip social distancing. It's very important we all follow social distancing.
Thank you, Dr. Mangalam. That was very, very helpful. And I think we all must get our zinc levels, vitamin C and all that level up and a balanced diet and wonderful exercising. And Dr. Vani, what is this something about herd immunity? What is this thing? Could you expand and let me know?
Yes. See, herd immunity is when 80 to 90% of the population is already infected. Now, what happens when somebody gets infected? After about 4 weeks, they have antibodies within their system. These antibodies prevent reinfection. So if 80 to 90% of the people had antibodies, then the virus will not be able to go from one person to the other because it will die because of the antibodies. So there will be no propagation of disease. So the disease just comes to an end and it perishes. Like, for example, we've eradicated smallpox. There is no smallpox. And how we've done it is by giving a vaccine. So basically, herd immunity can happen either by a vaccine. So everybody has antibodies after some time, and the virus does not propagate further, or the person gets infected, and then all the people get infected. So this is herd immunity. Herd immunity is a good thing because that will serve us to be protected in the course of time, but it may result in the loss of many lives because some people may develop critical disease and die in the process. But until the vaccine comes, I think herd immunity is probably a measure to gradually reduce this viral spread.
Okay, now we move on to the Q&A session. So I would request each and every one of you, the participants, to kindly raise your virtual hand so I would be able to take that question for you on behalf of you. Hello? Do we have any questions or hands raised as yet? Okay. Shall we move on? Yes, thank you. So now that we have discussed in general about COVID-19 and the current situation that is there, what about fertility, COVID, and us or you? So you are a fertility specialist, Dr. Vani, and I would like to ask, is it the right time to start my fertility treatment?
Right.
I'm sorry. I see a hand raised. I think we will go to the question, if that's all right. I'm sorry. It's a delayed question. Okay. Miss Nicola.
Hello,
yes,
can you hear me?
Yes, we can hear you, Nicola.
Hello, good evening to you all. It's lovely to see you all. Good evening, Dr. Vani and Dr. Mangalam. It's lovely to see you.
Nice to see you, Nicola. Nice to hear you.
Oh no, it's very interesting. It's nice to hear all about COVID-19 from a different part of the world. Your views, etc. And to hear, and it's very good to hear. What you were saying is very similar to what we are hearing in the UK.
Yes.
Yes. Can I ask? One about the questions that's really interests me is about boosting the immunity. I didn't quite hear. I heard vitamin C, vitamin D, zinc, turmeric, and ginger. Is that correct?
Taking all these yes, ma'am. Taking all these may help, but there is no proven evidence that everything actually helps. But there is no harm in taking it. Somebody is already, if their immunity levels are impaired, then these things, supplementing these things do it actually helps.
Yeah, that's good. I mean, I'm getting a little bit paranoid about what I'm eating and my vitamin intake.
It's actually important that we increase vitamin C. Taking vitamin C rich diet, it actually helps.
Yeah, Yeah, I heard vitamin C and vitamin D is particularly good for prevention against viruses generally.
Sorry, I couldn't hear well. Sorry.
That's okay. I have read before that taking vitamin C and vitamin D in large quantities is good to protect against viruses
The
generally.
articles show, recently what the article says is only oxygen and paracetamol is helping in fighting COVID, which means if somebody acquires the disease, mean the infection, then therapeutically, when being therapeutically giving paracetamol and oxygen, only these two are proven to help, in fact. So we can take supplements, but we cannot be at ease just because we are taking those, and we cannot take things for granted that we'll definitely fight it against. See, it involves many things. So if you're positive, then we can definitely fight against. We should take measures, protective measures as well.
Yeah. Yeah. No, I understand. I just whatever I can do to help, I think is good.
Yeah. Thanks for your question.
Thank you.
Yeah.
Thank you, Nicola.
My pleasure.
Yes. So, Dr. Vani, so we'll move on to the next segment now. That's going to be talking about fertility, COVID, and you. So, Dr. Vani, you are the fertility expert here. I would like to ask, is it the right time to be visiting my fertility specialist, or should I postpone my treatment in light of COVID 2019?
Thanks for that question, Vasudha. Thing is that when the lockdown began all over the world, and when it was announced that this was a pandemic, many fertility centers closed. And this was because of two reasons. First, the resources and the staff were needed for important work, that is looking after the ICU and emergency. That was one reason. The second reason was that the actual effect of fertility treatment or the COVID on fertility treatment was not known at that point. But now, 6 months down the line, we have seen that fertility treatment actually is not affected by COVID. And now many centers are opened or they're opening. It really depends on how many cases there are in that particular area. But most of the centers are getting started. The thing is, regarding the reproductive tract, the receptors I spoke about are not present. Or if they are present, they're present in very, very small numbers. So COVID does not affect reproduction, and these receptors are not present in eggs and sperm as well, so we can do treatment. But the important thing is, a person must not be COVID positive. And in that case, we will have to temporarily postpone treatment. So what we do is, on day 2, if anybody knows how IVF is done, on day 2 of the period is when we check for COVID infection and make sure the couple or the patient is negative, and then start stimulation and repeat the test after 10 days, making sure the woman is negative, and then plan the egg pickup. So we tell the couple to necessarily be isolated and to take every measure possible to avoid getting infection. And as far as the male is concerned, the partner is concerned, once again, we ask him also to take necessary steps to avoid getting infected, and we check his COVID status as well before we start treatment. So we're very careful. Now, if a couple happens to be, if the lady happens to be COVID positive, at any time during treatment, we will be forced to cancel the cycle until later. And if the man turns out to be COVID positive, then we don't use his sperm, but we freeze the eggs, and then we fertilize the eggs later. So this is what we do. So fertility treatment can be safely undertaken. That's the answer to your question.
Yes, thank you, Dr. Vani. And but is it safe to get pregnant right now?
Yes, see, I think actually there's going to be a baby boom in 10 months down the line, because there have been so many conceptions the world over because of this lockdown.